Hello everybody, I am Dr. Amit Gupta. Today we will discuss about ECG. First we will learn the basics of ECG, then we will try to diagnose different kinds of cardiac disorder using ECG. This is a normal conduction system. As you already know, it starts with SA node, which is pacemaker of heart, and ends in Purkinje fibers. What is an ECG? The electrocardiogram is a representation of the electrical events of the cardiac cycle. What types of pathology can we identify and study from ECGs? Like arrhythmias, myocardial ischemia and infarction, pericarditis, chamber hypertrophy, electrolyte disturbances like hyperkalemia, hypokalemia, and drug toxicities. PQRST are the different waveforms of ECG. P waves represent atrial depolarization. QRS complex represent ventricular depolarization. T waves represent ventricular repolarization. Atrial repolarization is not shown in ECG as it is superimposed by ventricular depolarization, means QRS complex. In ECG paper, horizontal axis represent time and vertical axis represent voltage. Horizontally, the one large box represents 0.2 second and vertically one large box represents 0.5 millivolt. These are different waveforms and intervals of ECG. P wave represents depolarization of both atria. Relationship between P and QRS complex helps distinguish various cardiac arrhythmias. Shape and duration of P may indicate atrial enlargement. PR interval. It starts from onset of P wave to onset of QRS. To remember normal PR interval, just remember 3 to 4 horizontal boxes. It represents atria to ventricular conduction time. Prolonged PR interval may indicate a first degree heart block. QRS complex represent ventricular depolarization. It usually larger than P waves because of greater muscle mass of ventricles. For normal duration of QRS complex, just remember 2 to 3 small boxes. Its duration, amplitude and morphology are useful in diagnosing cardiac arrhythmias, ventricular hypertrophy, MI, electrolyte derangement. Q wave greater than one-third the height of R wave or greater than one small box are abnormal and it may represent MRI. ST segment. It connects QRS complex to T waves. Its normal duration is around 2 to 3 small boxes. T waves represent repolarization or recovery of ventricles. Interval from beginning of QRS to apex of T is referred to as absolute refractive period. QT interval. It measures from starting of QRS to the end of T waves. Normal QT is usually around 0.4 second. It means 10 small walks. QT intervals varies based on heart rate. ECG leads are electrodes which measure the difference in electrical potential between either two different points of body or one point on the body and a virtual reference point with zero electrical potential located in the center of the heart. The standard ECG leads have 12 leads, 3 standard limb leads, 3 augmented limb leads and 6 precordial leads. The axis of a particular lead represents the viewpoint from which it looks at the heart. To remember direction of particular leads, make a triangle between right arm and left leg. Always remember direction of lead 1 is towards left arm from right arm and lead 2 towards left leg from right arm and lead 3 towards left leg from left arm. Always remember normal angle of each lead, as lead 1 has 0 degree, lead 2 has plus 60 degree, lead 3 has plus 120 degree. Similarly, angle of AVL is minus 30 degree, angle of AVR is minus 150 degree and angle of AVF is plus 90 degree. Always remember angles of all limb leads. As we can see, lead 1 looks at the heart from the left side and AVL from the left side, AVR from the right side and lead 2, AVF and lead 3 looks at the heart from the inferior side. These are the precordial leads V1, V2, V3, V4, V5, V6. Here we can see V1 and V2 represent septal part, V3, V4 represent anterior part, V5, V6 represent lateral part of the heart. This is a summary of different types of leads: limb leads, precordial leads. Now we will see arrangement of leads on the ECG. Anatomically, septum is represented by V1 and V2, anterior wall is represented by V3 and V4, lateral wall is represented by lead 1, AVL, V5 and V6. Similarly, inferior wall is represented by limb 2nd, 3rd and AVF. Pacemakers of heart. SA node, it is a dominant pacemaker with an intrinsic rate of 60 to 100 beats per minute. AV nodes, it is backup pacemaker with an intrinsic rate of 40 to 60 beats per minute. Ventricular cells, these are also backup pacemaker with an intrinsic rate of 20 to 45 beats per minute. From here, we will learn to analyze the ECG. First of all, we will talk about rhythm analysis. It should be done step by step. In step 1, we should calculate rate, then regularity, then assess the P waves, then determine the PR interval, finally determine the QRS duration. For determining the heart rate, there are the two methods, rule of 300 and 10-second rules. What is a rule of 300? Take the number of big boxes between the two QRS complexes and divide this into 300. The result will be approximate equal to rate. Although this method is fast, but remember this method only works for regular rhythms. Just try to find out the rate in this ECG strip. Here we can calculate there is 6 large boxes between two QRS complex. So 300 divided by 6 is equal to 50 beats per minute. Now what is the rate of this ECG strip? There is approximately 4 large boxes between two QRS complex. So rate comes out to be 75 beats per minute. What is the rate in this? There is approximate 1.5 large boxes between two QRS complexes. So it comes out to be 200 beats per minute. It may be easiest to memorize the following table. If there is a number of big boxes between two QRS complexes is 1, then rate is 300. Similarly, for two big boxes, rate is 150, for 3, rate is 100, for 4, rate is 75, and for 5 big boxes, rate is 60, for 6, rate is 50. Now 10-second rule. As most EKGs record 10 seconds of rhythm per page, one can simply count the number of beats present on the EKG and multiply by 6 to get the number of beats per second. This method works well for irregular rhythms also. What is the rate in this? Here we will count the number of times the QRS complex is present in this strip. Is 1, 2, 3, 4, 5, 6, 7, 8, 9, 33. So it comes out to be 33 into 6 is equal to 198 beats per minute. Now we will learn how to determine regularity of the ECG. First of all, look at the RR distance using a caliper or markings on a pen or paper. Regular are the equidistance apart, occasionally irregular, regularly irregular, or irregularly irregular. What is your interpretation in this? This is totally regular ECG. Now we will assess the P waves. Are there P waves present or not? Do the P waves all look alike? Do the P waves occur at a regular rate? Is there one P wave before each QRS? What is your interpretation? Normal wave with one P wave for every QRS. Now we will determine PR interval. It should be normally 0.12 to 0.2 seconds. Roughly we can learn by 3 to 5 small boxes. What is your interpretation here? It's normal, 0.12 seconds. Now QRS duration. Normal QRS duration is 0.04 to 0.12 seconds, means 1 to 3 small boxes. Interpretation 0.08 second here. We will summarize the rhythm here. What is the rate in this ECG? It's usually around 90 to 95 beats per minute. And this is regular? Yes, this is regular. P waves are normal? Yes, P waves are normal. What is the PR interval? It's 0.12 second. It means normal. QRS duration, 2 small boxes, means normal. Interpretation, it's a normal sinus rhythm. Now we will learn about QRS axis. The QRS axis represents the net overall direction of heart's electrical activity. Abnormalities of axis can hint at ventricular enlargement, conduction blocks like hemiblocks. QRS axis. By near consensus, the normal QRS axis is defined as ranging from -30° to +90°. -30 to -90 is referred as the left axis deviation, and +90 to +180 is referred to as right axis deviation, and from -90 to 180 it's indeterminate axis. We can determine the axis by two approaches. First is quadrant approach, second is equiphasic. For determining the axis, look at the QRS complex. Either it is predominantly positive or negative, or either equiphasic. Quadrant approach. Examine the QRS complex in leads first and AVF to determine if they are predominantly positive or predominantly negative. The combination should place the axis into one of the four quadrants below. Here we can see if QRS complex is predominantly positive in both leads, lead 1 and AVF, it's normal axis. If it's positive in lead 1 and negative in AVF, then it's left axis deviation. If negative in lead 1 and positive in AVF, then it's right axis deviation. If negative in lead 1 and negative in AVF, then it's indeterminate axis. If left axis is present, examine lead second to determine if the deviation is pathological or not. If the QRS in lead second is predominantly positive, then LAD is non-pathological. In other words, the axis is normal. If it is predominantly negative, it is pathological. Example first, find out the axis. Here we can see the QRS complex is predominantly negative in lead first and positive in lead AVF. So it's right axis deviation. Now example 2. Here we can see positive deflection in first and negative in AVF and predominantly positive in lead second. So it's normal axis, means non-pathological left axis deviation. Equiphasic approach is a little bit complicated to find out the axis, so we will discuss it later. Thank you. This is all about basics of ECG. In next video, we will learn how to diagnose different types of arrhythmias, ischemic heart disease and other disorders. So please like, share and comment on video, and do not forget to subscribe my YouTube channel to get all the stuffs. Thanks.